in our pain clinic, everybody comes in pain and it's suffering, and we alleviate pain for these patients and accomplish that. It's unfortunate how we're viewed and perceived as the pill people. Just come go to your pain doctor, get some narcotics, or get a steroid injection, and that's the least of the things I prefer to do. That's what wants to be pursued by a lot of people is narcotics for the immediate gratification and some steroid injections, which they could give you temporary relief, but not long term. Mm-hmm. So, and most importantly, I think it's identifying the cause of pain. So you were labeled as having headaches, which truly were not headaches. They were coming from your neck and the muscles of the back of your neck. And once we address that, but now we want to go deeper and address why are you having that? Why will we take 1,000 women like you and you're the one that has this? What prompted you? Medicine has no explanation, so we have to go into alternative medicine and holistic medicine and look at hormonal imbalances, look at previous scars that your body has suffered. That every disease, every scar, every insult to your body in the form of vaccines, heavy metals, toxins, food, alcohol, cuts, scars, trauma, accidents, surgery, hospitalizations, it's embedded in your body. It stays with you. And the degree of that scar, the degree of that insult to your body will in turn give you disease down the road, will make an organ sick. And that organ will degenerate into a disease. And that's what we're going to do now. I would say the injections we did will give you about a year worth of relief, but that's going to come back. Now we've had to make sure that it doesn't come back. Fix the problem altogether.
So stop the pain, then fix the problem. Mm-hmm. Okay, I'm up for that.
Short term, midterm, long term.
Yes.
Let's do this.
Okay.
So our model patient here came to us with a headache. And after examination, we determined that it was coming from the neck. The joints of the neck inflamed the muscles, the nerves and tendons of this whole occipital area, causing what was perceived as a headache. We did some injections and procedures to test my theory that it was coming from the neck, and the test was successful in improving the pain short term. We did a procedure to make it last a little bit longer. What we're looking for now is, why did she have these issues? We're looking at holistic medicine, alternative reasons as to why somebody will have a headache. And several theories exist, and what we're looking at is scars in her body. Scars coming from surgeries, hospitalizations, stitches, broken bones, procedures, gynecological procedures, toxins, vaccines, heavy metals, dental work. And we're going to use a detoxification method that supports organs first, cleans the organs, and then clears and cleans the space in between the cells. Our cells in our body are very, very small, but the space in between each cell is much bigger. There's a lot of life in there, a lot of energy, a lot of compounds that live there. And we believe that that's a place where all that is stored. So what we use is muscle testing. Example of this is her body's going to tell us where the problem is. So she's going to hold her fingers nice and close, and I'm going to try to open it. So she's a strong woman, it's very hard to open. So we've already tested this before. She's going to take her hand and put it up on her thyroid. And when I try to open it, it takes very little to open her finger. And she's a very strong-willed person, very caring. And we're going to place it over her heart. Keep it nice and tight. And her heart is super strong. And do you drink alcohol much? Or,
occasionally.
You drink a lot. You eat a lot of candies, sugar.
No.
Pretty healthy.
Yeah.
So we're going to put it over her pancreas area, and and look at that. I can't open it. So now we're going to take our hand and we're going to place it in the back towards her adrenal glands. And it opens up like nothing. Adrenal glands support stress. And then we're going to take your hand and put it like this and point. And we're going to point it towards gynecological area. And we open that, and it takes absolutely no effort. It's a no-brainer. Most women will have some sort of gynecological injury. There's multiple reasons why this will open up. So then one thing is to identify where the source of problem is, but now what we want to do is identify which remedies will be available. So what we're going to do is we're going to ask her to point at each one of these categories, and these are remedies for individual categories for organ support, detoxification, and there's some herbals and other compounds. Just about every homeopathic remedy and combinations of homeopathic remedies. So now, one more time, she's gonna pull this hand will open up, and with this little finger, she's gonna touch one by one. And we're gonna go open it, and it opens up. So we'll go to the next one, and it opens up, and we keep going, and it opens up, and we keep going, and it opens up, and next one, and that's a tight one, very tight. And let's go on the next one, and that's a nice and tight. And let's go to the next one, and it opens up, and next one, and that one opens up. So these three were questionable, so why don't we go one by one on these three. So we'll do the first one. I'm gonna stay here for a second. That's questionable. Go on the next one. That one is nice and tight. Go to this one, and this one is nice and tight. So I think it's in these two. One more time so you can see it. This one, it wanted to, but it's sort of kind of like that. It's not as hard as I want. And this one, which is that one is nice and tight as well. So we're going to concentrate on these three ones. So what we're going to do is we're going to pick one by one on these remedies, and we're going to point. She's going to point at each one of those, and then we're going to pick one by one. So finger on this one, that opens up, and then we're going to go one by one. Go, open, 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 open. Keep going, keep going. Go back out a little bit. Okay, I'm going to take this one out. That one was a positive. No, 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 no. Keep going, keep going. Excellent. Next one. Open, open, open. Keep going. Go. Go back here. Keep going. Next one. Okay, so touch the one that I pull. Tight. Next one that I pull. Tight. Excellent. And I'll go through this one. Keep going. Okay, next one. Go back. Nice and tight. Next one. Next one. Okay. So now we have this 4. Hand is tight. And then just recheck those real quick. That's a yes. That's a yes. That's a yes. And that is, that's kind of questionable, maybe for later. Okay, so what we're going to do is hand down there and keep it nice and tight, nice and tight. Come on, tighter, tighter. Okay. Now you're going to hold these two and put it down there. I can't open it. And hold this and just kind of hold it, I guess. That's a very tight, very tight. Let's put them all together, hold them in your hand, nice and tight, nice and tight, nice and tight, nice and tight. That's very good. Okay. So we found her, not surprising, Gyn Tox, Fem Tox, and prescription tox. So those are, we can talk at length about those later and what each remedy represents, but we have chosen her remedies. Her body's going to change and accept different medications. We start with this. She'll treat it, finish it for a year. And after, it takes about a month. She'll finish it for a month, after a month, and then we'll retest, and then her body will accept a new remedy. We have to support the organs first, then take the toxins out of the organs with a different remedy. So this is the first step of treatment. We have these remedies right here chosen for her. And we're going to have you just hold them on your lap. And keep it nice and tight, nice and tight, nice and tight, nice and tight. And those are the remedies for her. Those are yours.
Wow. And so how do I take these?
These, you put a full dropper in warm water. They're based on, they have an alcohol base. Warm water evaporates some of the alcohol and potentiates the remedy. So you put a dropper twice a day. This is adrenal support, Fem Tox, and Gyn Tox. And different combination homeopathic remedies in each one of them.
And so then it works on my organs to get rid of...
First it's going to support the organs.
Okay.
And detox a little bit on the organs. And then we'll go to the extracellular space and do a deeper detoxification. But this is the first step. And to be honest with you, from this company and a few of the other homotoxicology companies available, what they like to do is they do have a system where they support the organs, they do the detoxification. Me personally, what I like to do is ask your body. Your body will tell us every single time. And you are pointing at those remedies and you have no idea which the remedy is. Once the remedy comes out, we'll double test it, triple test it, and your body's telling us what to do. We finish this, we go back in a month and we recheck and see what else is coming.
Great.
And I like to face the label down so I'm not even looking at it myself. And it becomes more your body's intuition.
Great. Well, I look forward to doing it. Anything that's going to help.
Okay, so those are your remedies, and now we're going to do some neural therapy, which is a neural therapy comes from Germany. It's the Huneke brothers back in the 30s. One of them was an orthopedic surgeon, the other one was a gynecological OBGYN physician. The orthopedic doctor noted then when he injected the scars of needles or injected a knee, he noted that other symptoms disappeared. One patient said, after you did my knee injection, my rash went away. Another one was having an asthma attack, a mild asthma attack. He says, as soon as you injected here, my asthma went away. I stopped breathing hard.
And it was a scar?
It was a scar from a previous injection. She was having pain. And that sparked his curiosity. And then he started systematically injecting scars and documented. And he theorized that the scar was causing a blockage of the circulation of energy, the channels. And it takes us back to the chi of acupuncture. How acupuncture speaks of a blockage of the energy or the chi. And his brother came in and started doing injections in females for scar injections and had similar results. Then they brought other colleagues that from different specialties and they started doing different injections and created what today is known as neural therapy. And the basis of neural therapy is to stop the interference in your body from disease, from injuries, from any kinds of scars. We talked about what the scars were before. So now we're going directly to stop that interference. What they inject is local anesthetics, lidocaine, procaine. Lidocaine brings out the energy in a cell, re-energizes a group of cells. So by bringing energy, almost inflammation kind, that area is revived, and the circulation or the proper conduct of energy comes back, and we have seen things short of a miracle with these patients. What we do to you, that injection in the back of your head, the test in traditional medicine is called an injection of the brachial, the medial branch block, which is nerves that come from the spine. But in neurotherapy, it's just an injection of the segments of the neck. It's identical, it's the same thing, different names, different expectations. So we were treating you with some natural medicine from the beginning,